Here's the big question.
How are agents like us,
who didn't get an opportunity to invest in a franchise early,
who are spending time and money to sell homes,
building someone else's saleable asset?
How do we grow a business but still build wealth?
Have an exit strategy,
and get a piece of the pie that's not dependent
on us working more hours and every weekend?
That is the question, and this podcast will give you the answer.
My name is Jay Kinder.
My name is Al Stasek.
And I'm Michael Reese. We are your hosts, and welcome to the One Big Fire podcast.
All right. And we are live. Margo, welcome.
Glad to be here.
Thank you for coming on and sharing this super important information with all the real estate agents that need this desperately. And before we get started, I know you met my co-partner Snoop Dogg. He's super interested in what you have to say too. So
precious.
Yes, thank you. So without any further ado, I know who you are. Everyone at eXp knows who you are. But tell our audience, especially the real estate agents out there who need healthcare, who don't have healthcare, or maybe paying too much for it. Who are you? What do you do? What's Clearwater? Let's get everybody snuggled and familiar with that.
Okay, that's great. That's a great term. I'm Margo Wickersham, and I'm SVP of Strategic Partnerships at Clearwater Benefits. Clearwater is a brokerage licensed in all 50 states with a consulting team of consultants who are licensed in all 50 states. So we have access to a wide variety of health insurance and we call them innovative plans that provide health care across the country. And we have access to plans that we don't see offered anywhere else that are, for most people, a great way to save money, increase access to doctors, improve their network, and save them money if they do need to use their plan so they avoid becoming one of the statistics. 2/3 of bankruptcies in America caused by medical care costs. And 60% of those people had insurance. So we want to avoid that at all costs. So what we're here to do, is be a resource. We're consultants, and we're here to help agents find the best plan for them. It'd be really great if there was one size fits all cookie cutter, but that is not the solution. So we're here as a resource. Specifically, we have partnered with eXpRealty, and we provide a custom solution for them and the agents who are eXp agents, and they have access to it from the first day they're there.
That's amazing. So just so I heard you correctly, and if everyone's out there listening, I wanted you to catch this. About 60 to 66% roughly of all bankruptcies are caused because of healthcare piling up and sending people into some financial trouble. And of those people, 2/3 of them actually have a health insurance plan, but it still gets them into trouble, which tells us that it's either costing them too much money, that the health plan that they have just isn't good enough. It's not strong enough, meaning their network isn't that great, or their maximum yearly out of pocket's too high. Would that be accurate?
It would be that, and then a third kind of secret stealth mystery bucket. And that is that when you think about your deductible and you think about your max out of pocket, those are kind of fake numbers, because as long as you're in network, those are the numbers. But what if you collapse and you are taken to an emergency room in an ambulance by someone who doesn't ask you, and you're unconscious, what your network is? And you end up with $100,000 in life-saving bills. That's not going towards your out-of-pocket. It is not going towards your deductible. That's not even talked about. So that's where a lot of it goes wrong. So that would be surprise billing. That would be when you're out of network. Surprise billing can also happen when you're in network and you have a procedure. Let's say you're super smart and you get you're going to have a shoulder surgery. You find out where your surgeon is and the surgery center. You make sure those are in network, good to go. You have the surgery. It all goes great. You're rehabbing afterwards and the bills start coming in. And you're like, but I did my due diligence. I found a surgeon and a surgery center that were in network. What happened? There's so many people in the room that you don't know about that are going to charge you. And so a surgical assistant might not be with the surgeon, and he or she might not be with the surgery center, because this is another way for them to charge money. And so they will charge you that's a surprise bill.
Yeah.
Because you didn't know it was coming. Anesthesiologists are often in that category. So what I advise people to do is no matter what plan you're on, when you know you have a procedure or surgery or hospitalization coming up, then say, who's going to be in the room? Who's going to send me a bill? I need to know everybody who's going to want to send me a bill and who will be in the room. And then I need to make sure that they are in network. And if they're not, I need to make sure someone is. That's the only way to avoid surprise billing. So that's a tip I want everybody to know, no matter what kind of plan you're on.
Yeah.
Yeah. And secondly, balance billing is when the provider, so doctors, nurses, the surgical assistant, surgery centers want to charge more than the insurance company wants to pay them. And guess who's on the hook for that? We are, the patients.
Yeah.
Right. So that doesn't come out of your or doesn't contribute towards your deductible or your max out of pocket. So it's like a very narrow, really not accurate view of the world that we live in when we need to consume healthcare, basically.
I literally just had that situation happen with me where it was like certain amount wasn't covered, but then they were like, oh yeah, that doesn't go towards your max out of pocket. Well, I'm like, well, this is out of my pocket. So how does that not contribute to the max out of pocket? You know,
how do you make that work? Yeah.
Right. That's just feels wrong to me. It doesn't. And there's a lot so for us real estate agents, you know, we typically are good at a few things and we're typically not good at some other things, right? The things we're good at is, you know, mixing with people, helping them solve problems as it relates to selling their home, you know, being their advisor as it relates to make it maybe one of the largest sales that they could ever have. What we tend to not be great at are saving money, taxes, you know, and then figuring out healthcare plans. The reason I know that third thing is I was just sharing with you backstage before we came on here that prior to eXp rolling out this partnership with Clearwater, we had to redo our health plan for my whole company, Stasek Group in Ohio. So all of our employees and everything, including me and my family, we all had to, you know, agree, so to speak, on, you know, what direction we wanted to go. It was hard. It was so difficult. I felt like I couldn't get a straight answer out of the person. And it wasn't so much, I felt like I could trust them. It just was hard to figure out and make sense of it. And I'm not the sharpest knife, but I'm also not the dullest knife in the box either. You guys have a system, a concierge system that is like paint by numbers that helps people, real estate agents, kind of make the right decision that's best for them and their family, right?
Yeah, that's a really good point. And you have just outlined something a lot of people struggle with. It's a cumbersome process to understand what the options are. There are things like what we just talked about, where you get bills that are surprise bills and balance bills. That's not discussed or addressed in any of the paperwork and any of the descriptions of the plans. There's a lot you need to know that's really hard to understand, hard to get that information. And by the way, how can you be a subject matter expert in that? In addition to the subject matter expert you are as a real estate advisor. So we are the healthcare advisors, like you are the real estate advisor. So we are subject matter experts in all things healthcare and what's available. It varies by state, depends on phase of life you're in, depends on income, depends on your aptitude for going to the doctor. So a lot of people say, I'm so healthy, I haven't been to the doctor in 15 years. And we think, you may or may not be healthy. We don't know. So we want to right size the options, and we know what all is out there and we know where the pitfalls are. So our team of consultants listen, find out what your needs, what your preferences are too. And then we will right size the short list, I guess, of plans that make the most sense for you to consider. And then we can say, here's what you need to watch out for here. And over here is another thing to be aware of. You know, and you tell us a little bit about your healthcare, and we'll know basically which direction makes the most sense for you. And we'll help you weigh the pros and the cons. In fact, one of the things we do that seems to be really popular with agents is give them a side-by-side comparison of what plan they're on now or one they're considering with options that we can provide to them. And that helps give them more of an educated approach to the decision-making on it. It's really important.
Yeah.
But really hard to understand.
I'm the type that you got to really dumb it down to a third grade level for me. I you know, just the bullet pointed side by side is I think the best focusing only on the bullet points that kind of resonate, the out of pocket, the yearly out of pocket. That one's a biggie because no one really thinks about that. Like you were saying earlier, they don't pay attention to that big number because that's only if something, bad were to happen. We'd actually have to deal with that. I also want to talk to the options. You guys have a lot of options, and sometimes that actually, freezes people up too because you give someone too many options. But I think the biggest thing is real estate agents. A lot of times their income, goes up and down and up and down, and we call it the commission roller coaster ride, which no one ever wants to be on. It's just we have a seasonal business. A lot of times you have really, really great months, sometimes not so good months, which I think a lot of people, there are going to be people out there that say, hey, I want coverage. I want to make sure that I'm covered, but I want, what's the least amount of monthly out of pocket I could do. Then you have others who are, maybe they're doing a little better and they're like, show me the Cadillac, show me your Cadillac plan that has, low or no deductibles. I know I was just listening to a couple of the videos of agents that were putting testimonials up where their deductibles or the co-pays just like went away. Their deductibles, they're saving like $500 a month, off of their monthly. Talk to us a little bit about the options that you guys have.
Right. It's a great question. And it's not something that most of us think about when we think about health insurance. You think, well, the options are the options, aren't they? And they do vary. What we see is that you've got all the plans that are on the exchange. Everybody's got access to those in your state. The state has laws that we all have to follow, which determine which plans are available. So I'll give you an example that even that's hard to understand. And that is only one category of tools we have in our tool belt. So we've got all of the plans that are on the exchange in any given state. We also have some other major medical plans not available on the exchange. And finally, our third, and actually our most popular category, is an innovative set of plans that we've created by putting an insurance plan with medical cost sharing together. That generates the most savings, that generates the highest protection for your out-of-pocket risk of out-of-pocket expenses should something happen and you need your plan. And that provides the broadest, it's a nationwide network for the insurance plan, and it's actually global, go anywhere to anyone that you want for the medical cost sharing plan. And that's for the expensive parts of healthcare, like surgeries. So we have a suite, a large suite, and we're constantly looking for new things, constantly innovating. We brought Teladoc to eXp the minute the pandemic broke. We negotiated a really good deal so that eXp agents could get the lowest price possible for Teladoc. And then actually NAR came out a month or two later with a telehealth offering, and it still wasn't as good as what eXp agents had access to. So we're constantly looking for the next best thing and how can we look at this and find better solutions all the time for agents, because it's a conundrum and things never stay the same. They are always changing.
Yes. And I'm reading some comments. That's why I keep looking away because I can't see them on our StreamYard. But there was an agent that actually had a pretty good question. He went online and just kind of entered his information online, and the quotes were a bit high. How would he be able to, and I'm actually going to put this up on the screen for everybody. How would he be able to, or she, be able to actually get in touch with someone who could walk them through the options that would fit their budget a bit better?
Right. Just to understand what your options are, it's a good idea. We have a link that you can go to, which is bit.ly, bit.ly/ this is a broad audience of realtors, correct?
Yes.
Okay, let me give you a specific link for that. And I have to pull it up because I don't have them all memorized. I have quite a few of them.
Like www.bit.ly?
Yes, it is. You do have to do that. Okay, I've got www.bit.ly/agent health.
Lee. That's L.
Ly.
Okay.
/agent health.
Agent hell. All right. .com.
No, because that's just it. Because it's the bit.ly instead of .com. Yeah.
Okay, cool. Great. Add the banner. Let's go. All right. I just put it back up on the screen now.
Well, nice. Nice. And I see that Becky was happy to have kind of a gap to get her through until she could get on Medicare. So one of the ways that we work our system is we look at, well, where can we make the biggest difference? We approach it from that standpoint, and nobody can compete with Medicare. So we don't try. That is the best solution if you're 65 and above, and then you add some supplements, boom, you're done. That's the recommendation. Nobody can beat that. There's no point in even trying right now.
Right.
Another one, if you are on TRICARE and you're going to continue to be on TRICARE, that's tough to beat as well. Probably a good place to stay. However, if you're on COBRA, that's going to be super expensive. It's going to expire at some point, and it may not even have a very good network. If you are on a plan through an employer, that may or may not be a good plan for you. It depends, because the employer made a decision about which plan or plans to offer. You weren't involved in that, so you get the plan that you get. And maybe it's great, and maybe it's not. Maybe it's great, but not for you, because it depends on what your needs are. Do you have a family with a lot of medications, a lot of medical conditions that you're managing? That need is going to be totally different than you're single, you're 50, everything's great, you hardly ever go to the doctor, you just want preventatives. Completely different. And as a person who's launching kids in various degrees of college and COVID and all of that, yeah. I understand as your family or your household changes, your needs do. So that's the right sizing part of it. Mm-hmm.
That's awesome. One last thing I wanted to touch on before I know you're a busy person. I want you to get back to your day. It was, what was I going to say? Darn, I just lost track of my thought here. And I was.
While you're thinking, I'll address James Whitstone's comment. He says,
let's do that.
Insurance quote was, did you get a quote from us at Clearwater, Jake? Is that what you're talking about? Or are you talking about an insurance plan that you had quoted from another source? It can be really frustrating. It can vary so much. We can see a difference from $500 to $3,000 a month in difference in the premium. And that's a crazy amount of money. So part of what you want to do is hone in on, I don't want to buy more than I need. I want to make sure I have what I need and not more than that. And it varies. You know, some people just want catastrophic. So did he answer? Let's see.
I just remembered what it was.
Oh, good.
It was for real estate brokers and teams. So yes, he said him and his two kids from Clearwater. Yep. So maybe that bit link that you just sent me will help a little bit better connect them to the concierge. So we talked about single agents that are out there, you know, at different income levels. We know that there's teams and brokers out there that actually have employees. You mentioned an employee plan, right?
Right.
So for instance, myself, I have a team of about 35 agents and 3 or 4 employees, you know, that run our Cleveland operation. And we provide health insurance. We pay a portion of our staff's health insurance, and that's the one I'm on as well. Do you have plans for brokers that are listening, or team leaders that want to, you know, a better plan for their staff?
Absolutely. We do. That's a really good point. We don't talk about it very often because we're so focused on the 1099 self-employed people of the world, a third of which almost don't have anything at all. And we want to see people have something. But in fact, we do offer group plans and have available to us the ability to look at them and see, all right, well, let's weigh these other plans that we have that are for individuals. Sometimes those are the better fit, but then we have group plans available. So we'll just take a look at it and, again, right size the options for what makes the most sense for you and your team.
Awesome. I love the fact that there's literally a consultant that you can sit down with that's going to walk you through the different options, that's going to look at your current plan if you have one, so that you can actually know, are you good where you're at and just stay put like you were mentioning earlier? Or would it be better, not just financially, but also just with that quality piece that isn't mentioned all the time as well, of switching over to one of the plans that we offer through EXP and Clearwater. So thank you so much, Margo. It was great. I got to meet you in our meeting last week. That's really what opened my eyes up, because as I shared with you, I had just gone through this entire process And I thought it was going to be a big pain to have to go through it again. I'm absolutely, especially after the experience I've had in the last 12 months of some of the bills that I've been getting, I'm absolutely going to go tap back into the solution. I'm going to make my appointment this week and chat with a Clearwater Solution and see if there's a better plan for myself, my family, and my employees. So thank you so much for being with us.
Absolutely. My pleasure to be here. And the great thing about if you do set an appointment like that and you find out that you're on the best plan, there's not a better way to save money and give you better care. Well, now you have peace of mind. You don't have to worry. You can move on to the next thing. Check it off your list. It's great to be here. Thanks so much for having me.
Absolutely. And if you like the content that you're seeing here, hit that subscribe button on YouTube. And as we say it, Kinder Stasek, we'll see you at the top or from the top. Have a great day, everybody.
Thanks. Bye.